Vignesh Alamanda. So I had the pleasure of meeting Mr. Evans recently, and he had a knee replacement done many years ago. And he's a very active individual. He cycles a lot, and is very involved with the community, teaching children how to ride bicycles. And he came in with onset of knee pain after his knee replacement with swelling. And when we first saw him, we got preliminary x-rays and worked him up. And unfortunately, at that time, found out that his prosthesis was infected. And as you can see from this first x-ray, this is the construct that he had in at that time. Unfortunately, infection after total knee replacement is a pretty bad problem, and it takes time and sort of patience. Mr. Evans was a terrific patient, complied with all our post-operative procedures and things of that nature.
Good morning. My name is Bob Evans. I had the experience, the opportunity to meet Dr. Alamanda a year ago as a result of some problems I was experiencing with the right knee.
So after our first meeting, when we have an infected total joint, one of the treatment options that is sort of as a high cure rate is sort of removing all the prosthesis and all the metal in there from before. Now it's a pretty big ask, but that's what we ended up doing.
I had had a previous knee replacement about 6 or 7 years ago, and it began to develop fluid, and it was painful. Dr. Alamanda did some tests and discovered that there was infection. We weren't sure what caused it, where it started, but then it was being pushed along by the bloodstream, and so it could have started anywhere in the system and wound up at the taken root and the weakest point, which turned out to be the bone. And so the initial procedure, diagnosis by Dr. Alamanda, was open it up, take out the previous prosthesis, replace it with temporary spacers or replacements, and then begin to cure the infection.
I took the prosthesis that was in there before, and as you can see from the second image, what we did was we placed a temporary prosthesis called a spacer. This spacer allows him to be active and sort of move with his knee, but nowhere will it give him the same functionality of a full knee replacement that he had before or that he will have eventually. But at least it will help allow him to go about his day-to-day activities in a relative pain-free fashion. And that's what we did. And that went well. And during that time, he's getting IV antibiotics to eradicate the infection. And then once that treatment is completed, we take fluid from the knee and sample it to make sure that the infection has been indeed eradicated. And Mr. Evans was a very compliant patient. Did all the stuff that he had to do on his end, and we got the fluid, and we were successful in eradicating the infection. And so that brings us to the next phase of the treatment plan. And as you can see from this third image, what we then did was we took him to the operating room, took that temporary spacer out, and placed a more definitive construct in. Now, this is a much more durable construct. This is a much more rigorous construct that will allow him to do the stuff that he needs to do and enjoy his quality of life. And he's quite a few months out from his re-implantation now, and he's enjoying life.
That was a 9-week procedure with antibiotics to get that cured, and we finally wiped out the infection, at which point Dr. Alamanda said, "We have a choice." We have a choice. Yes. Were you 95 and a couch potato, I'd recommend leaving the spacers in. You're not. So the choice would be either leave the spacers in or open it up and take the spacers out and put in a permanent knee replacement. What's the recovery time? 5 months. Oh, oops. Okay. Well, we can live with that. We did. He opened it up, he took out the spacers, put in the permanent replacement, and I will say that the initial recovery was painless. I'd asked for general anesthesia. I'd asked for no opioids, using Tylenol, and Mommy Nature smiled. It worked. 2 days later, I was out of the hospital and began recovery. And I'm now back to riding a bicycle, very happily. So thank you, Dr. Alamanda.
So in fact, the procedure went really well, and Mr. Evans is back to doing things that he likes to do. As of recently, he completed more than a 50-mile ride with his new prosthesis. A feat something that most people, even with native knees, it's a significantly difficult feat for most people. So he's out there enjoying life, and we're glad that we could play a small role in getting him back to where he needs to be.